actually the venous load or venous blood flow is responsible for the preload of the heart. Okay, but the outgoing of the flow, whichever stroke volume or whichever volume your heart is pumping out with every stroke or every beat, that's actually going along your first key diye ekhan theke, which is the structure which allows the outflowing of blood from your left ventricle to the body. Follow out. Okay, so furthermore it divides into various branches. It goes up, it goes down, like abdominal aorta, it goes down. Okay, and there is an arch, right, brachiocephaly. So along all these things, actually the outgoing blood is always going through your arteries first, then it will go into arterioles, then it will go into vein and come back to heart. So this is the typical structure. The arterioles are situated in your peripheries, the most peripheral part of your body. So that's why we are able to feel the pulse in your arteries, not in your veins. Okay. Next, so now what is pulse? Pulse is feeling of pressure waves along with or transmitted along with your arterial wall or along your arteries. Okay, during which phase of heart? Cardiac systole. Cardiac systole. Why systole? Because during systole only the heart pumps out blood. Okay, in diastole the heart doesn't pump out. So whenever the heart will pump out, only then we will be able to feel the pressure of the flowed blood. Okay, so that's why the cardiac systole terminology is important. So whatever, in which areas we can be able to feel the pulse? So there must be not only one artery, there must be various arteries. Good. In which you can be able to see the pulses or feel the pulses. Rather, we don't see pulses, we feel. Kon area you know? Which area you know? Okay. So everyone put your hand in this groove below your jaw or below your mandible. Is everyone able to feel the pulses in your own? Sabai বুঝতে পারছো? Okay. So this pulse will be called ki bolbo? Carotid pulse. Since it's felt on the carotid artery, so it will be called as carotid pulse. So according to the artery name, we will be naming the pulses. So the next is, if we go further down, here one is another artery. Ki naam ota? Radial artery. Okay. So radius is on the actually outer side. Okay. Here comes another clinical question, that is the difference between radius and ulna. First and foremost is girth. Okay. That is, the ulna is very weaker bone than the radius. Radius is thicker, and it's, so second difference is ulna is on the lateral side of your body, on the outside. Lateral means outside. Medial means closer to the midline of your body. Lateral means outside. Okay. So radial bone, or it will be situated in this area, in right hand, and in left hand in this area, because our body is bilaterally symmetrical. Dudike symmetry ache. That's why your radius is here and your radius is here. But when you go into the lower limb, the bigger bone, the thicker bone is on the inside, like tibia. Tibia bhetor dike thake. Tibia is on the medial side, but fibula is on the lateral side. So this is the basic difference in supex and infex. Anatomy to tomader sob bolbe. So first is this, and second difference is the position in upper limb and lower limb of the greater bone and the less thick bone. Okay, the situation is slightly alternated. Third is difference between radius and ulnar. Ulnar head is on what? Near the elbow, but radial head is near the wrist, near the wrist joint or wrist. Okay, so radius head, you will, in anatomy you will be able to do surface marking. आपको एक चौक ऐसा दिया जाएगा, आपको बोलेगा कि mark the radial head. So don't do it here. Ulnar head is on upper side, but radial head is on the below, the distal side of your body. So ulnar radial head is here. So radius is on the lateral side and radial head is here. So the pulse will be felt. The radial pulse will be felt in the radial artery along in this area. Okay. Over the radial head it's felt. Over the radial head it's felt. Okay. Next, there must be some specific situation of the hand in which position you will be able to feel the pulse the best. Okay. So very good. But the difference is, semi-prone is another thing and semiflexed is another thing. Which thing needs to be semi-prone and which things needs to be semiflexed? Okay, so forearm is semi-prone and wrist is semiflexed. Okay, flexion, extension, these terms you will have to be, compatible with. So by flexing, what do we say? Flexing your muscles. Okay, Like I don't have any, but this is flexing. Flexing is like this. In case of lower limbs, the flexing is like this. Like this. Coming together is flexing. And going away from each other is extension. Bolo na? Extend. Okay, so extend your hand. Boli amra. Extend your hand. So that's your extension. Extension. In case of leg, the extension is like this. Like this. Okay. So when we will be saying the person is the leg is on full extension, usually when you stand on one leg. Dekho, this is the most most extended your leg can get in one leg. In both legs there is slight flexion, you can notice. But when you are standing in one leg, look on both legs, that is complete extension. So this is there are some things in hyperextended knee and all. Ogulo tomra pore porbe. But this thing is flexion and extension. So wrist flexion is means like that. So the arm will be so the position of your hand will be like this. Only then you will be able to. You can you can make your hand in a fist or you can make it normal. Doesn't matter. The position matters. It needs to be flexed. So erokom kore tomra dekhbe. Now okay 2 2 2 2. Everyone feel your pulses. Tumi you go with that guy. পিছনে বা তুমি সামনে চলে আসো, তোমরা দুজন একটা টিম বানাও, তোমরা দুজন everyone measure each other's pulses and after 1 minute say me the rate. Okay, so I hope everyone is finished. তোমাদের হয়নি? এই তোমরা মেপেছো? তোমার পালস কত এসেছে? তোমার 77, তোমার কত? ও মাপো। তোমাদের হয়ে গেছে? বলো। कार 88, उसका 88 है, आपकी 88 है, आप नापे हो और आपका कितना आया? आप मेजर नहीं किए हो, नापो। তোমাদের হলো? বলো, তোমার কত এসেছে? कार 79, তোমার পালস 79, তুমি মেপেছো। তোমার কত এসেছে? মাপেনি? এই করো। তোমরা করলে? ওর 74 করো। 87, ওকে। ওকে, 1 মিনিট হয়ে গেছে। 75, ওকে। তোমাদের? তোমরা বলো, এই বলো। তোমাদের? তোমার কত? 72, 4, তোমাদের? তোমাদের হয়েছে কত কত? 69, তোমার? তোমাদের দুজনের কত হলো? जी करो, ठीक है, कोई बात, अच्छा करो। और किसी का हुआ है दोनों में से? তোর কত এসেছে? कोई बात नहीं, ठीक है, छोड़ दो, बाद में कैलकुलेट करना। नेक्स्ट, now so if you notice this is a norm, there is a range, everyone's beat, not beat, every. So first is the unit, okay, everyone is saying 76, 79, very good, but you have to use a term that is beats per minute, we call it BPM. Just like in case of mechanical terms, we rotation per minute, like RPM, whatever we can use. So now you will be using BPM, beats per minute. So there is, so now in homeostasis I already told you, it's a range, it's not a normal value. যখন তোমরা ছোট ছিলে, when you were little children, not little children, big children, okay, you have heard that the average human heartbeat is 72 bpm. So that's your average, okay, but every human is different, every human has different physiological functions working in his body, in his or her body, in every time, okay, every minute it changes. So the rate will be in a range. The normal range is around 60 to 100, 60 to 90, sometimes it is called as 60 to 100. So that's your normal range, right? Now, so normal range is 60 to 100 per bpm, 60 to 100 bpm or 60 to 100 per minute. Okay, so next is something we will call brady and something we will call tachy. So brady means less, tachy means higher. In various organs you will be seeing it, like in case of respiratory rates we call it bradypnea, tachypnea, okay. Apnea is your inability to breathe, right? Apnea. Just like them, bradycardia and tachycardia. Bradycardia means when your pulse rate or heart rate is high. Actually, heart rate and pulse rate are simultaneously proportional. Okay. So bradycardia means your actually heart rate or pulse rate that's high, low, and tachy means it's high, right? So in every abnormal, so this is an abnormal. So less than 60 BPM is your brady, and more than 100 is your tachy. 60 to 100 is your normal level. Okay. So now, whenever it's coming below 60, it's an abnormal value. It's not normal value. তোমাদের সবার তোমরা দেখলে it was around 60 to 90, 60 to 100 ওর মধ্যেই ছিল. So whenever it is coming down from 60 or whenever it is going up, more than 100, there is definitely some abnormality. This is not normal. So abnormal situation may arise due to two kind of things. One is which is dissipated or which is corrected without any external medication or external stimulation. Okay, खुद से ही बढ़ गया, खुद से ही घट गया. After you have provided some stimulus, ये बढ़ गया या घट गया. फिर whenever you remove that stimulus, okay, it will be coming back to normal without any external intervention. But sometimes whenever it goes up or whenever it goes down, it remains like that until and unless you provide with external medication or external stimulants. So whenever it is coming back to normal without any medication, that means the person doesn't have any disease. It was a situational based arise or downfall of your whatever. In this case, it's your heart rate, any kind of blood pressure, any kind of glucose level, like আমরা এখানে বলি glucose level, তারপরে হচ্ছে whatever RBCs, WBCs, whatever physiological ranges, creatinine, urea, whatever physiological ranges, they can rise in two ways. One is which will be corrected rise or down in two ways. One is it will be corrected without any external medication, but another is it will not be getting corrected without any external medication, not be getting corrected without any medication. That means you need external medication to correct it. So in first case, we will be calling it, when it's not needing any external medication, we will be calling it physiological changes. Okay. And whenever we will need external medication or external intervention, we will be calling it pathological. Patho means disease. তোমরা প্যাথোলজিতে পড়বে. Patho means disease. Pathology means study of disease. Similarly, physiology is study of your physiological functions. Similarly, এগুলো টার্মগুলো তোমরা accustomed হবে. Pathology, physiology, microbiology, pharmacology. The name comes from pharmacology means pharma মানে ওষুধ. So studying of drugs is pharmacology. घूम पाচ্ছে? तो कोई प्रॉब्लम नहीं. रात को जल्दी सोया करो. Next, आपका microbiology, study of microbiomes. Okay. So similarly, in here you will be seeing physiological changes and pathological changes. So ধরো এই যে তোমরা ক্লাস থেকে ক্লাস खत्म हो गया, आप चल के आए, ठीक है, तो नेचुरली दौड़ के आए, देर हो गया है, तो आपका हार्ट रेट एंड ऑल्सो रेस्पिरेटरी रेट दोनों बढ़ सकता है. आप दौड़ लिए. नाउ কেন হয় এটা? देयर इज नाउ তোমরা যখন ছোট ছিলে, when you were in 11 or 12, much more physiological actions you will just you have just known, but you didn't know the pathophysiology, the physiological structure or pathway behind it. Okay. So when you have entered MBBS, we will be now discussing everything with causes. So tell me, whenever we are running or we are walking fast, why our heart rate and respiratory rate both increases? Can someone tell? Actually, the oxygen demand is the actual answer, right? Because do any movement, our cells have to work more. Okay, any extravagant movement, our cells have to work more. If our cells need to work more, what do we need? More oxygen. If we now normal blood flow has certain oxygen, every hemoglobin can carry around 1.34 gram percentage of hemoglobin. So that's a steady amount. So now to provide more oxygen, every hemoglobin can carry 1.34 of oxygen. So to carry or to get more amount of oxygen, the body needs more hemoglobin to reach your cells. How will the body do it? কি করে করবে? How will the body provide this more need of oxygen in your body? to provide more blood flow to the cells. Okay, এবং এই blood flow বাড়ানোর জন্য, so to increase the blood flow, what your heart has to do? It has to pump faster. Only then it will be delivering more blood to your cells. So any kind of extravagant movement needs your physiological action, which needs your heart to beat faster. Not only that, your oxygen respiratory rate also need to be higher, because heart is pumping faster means only your blood is moving faster, but the oxygen saturation needs to be also better na, because there is ventilation and perfusion in your lungs, exchange of gases, right? तो कार्बन डाइऑक्साइड उधर लंग्स में बाहर आ जाता है, फिर वो निकल के आता है, एंड ऑक्सीजन अंदर जाता है, वो आपको वो एल्वियोलाई से आपका सेल में जाएगा, नॉट सेल, योर आर्टरी में जाएगा. तो अगर वो करने के लिए आपको not only your blood flow has to be greater, but also the oxygen intake. So to do that, your lungs will have to also perform more. That's why not only heart rate, but your respiratory rate also increases. You can ask, कि sir, शुद्ध blood flow बढ़ाले ही तो हो जाए तो, only the blood flow should have been increased, but only the blood flow increased. If your intake of oxygen doesn't increase, there will be a mismatch of required oxygen and carrying blood, right? So also your respiratory rate need to be high. এবার ডাউন কি করে? Now তোমরা দৌড়ে দৌড়ে এলে, এই যে এতক্ষণ, now for 5 to 10 minutes you are sitting down, your pulse rate, your heart rate and your respiratory rate all will come down. Why it is coming down? Homeostasis তো very generalized answer, আরেকটু আমায় ডিটেইলে এক্সপ্লেন করো. Very good. Now since you are sitting for 5 minutes, you are not doing any extravagant activities anymore, so your body need more oxygen now. Your body needs now normal amount of oxygen. So there is no need hyperventilating, there is no need of the heart to pump more blood, so slowly they will get into the normal range. So এই জন্য after you take some rest, okay, your heart rate and your respiratory rate both will come down automatically without any kind of medication. আমাদের কোনো ওষুধ খাওয়া দরকার হয় না, because of your bodily need decreases, it will decrease automatically. So we can call it as, why এবার বোঝা গেল কেন আমরা এটাকে physiological বলছি. Now we have seen অনেকের বাবা মার আছে, আমার বাবারও আছে, hypertension or hypotension. Hyper means more, hypo means less. So whenever a person is having persistently chronic long or not long high BP blood pressure, we will be calling it hypertension. Now when you are running, our blood pressure increases, but you are resting, your blood pressure is going down. But in those patients, why were we calling those patients and calling you normal? Because their blood pressure will not go down until and unless you provide some medication. That's why that is a pathological cause. So বোঝা গেল physiological and pathological need এর মধ্যে difference. Why are we calling it physiological? Why are we calling it pathological? Now এটা আমি প্রথম দিন, in this first few days, why am I talking about this elaborately? Because in case of every disease, in case of every abnormality, from now on, in case of every system, we will be studying two areas, one physiological and one pathological. So এই জন্য প্রথমে আমি এক্সপ্লেন করে দিলাম, যাতে এবার তোমরা অটোমেটিক্যালি বুঝে যাবে, from because every organ or every system will have some physiological causes of abnormality and pathological causes of abnormality. Now in case of bradycardia, বুঝতেই পারছো, in case of bradycardia, when the bradycardia is physiological, when you are sleeping, our body is not extravagantly working, our body is resting. So even the normal, এই যে আমি এখন কথা বলছি, I am talking, you are listening to something, your body, your cells are working. When you are sleeping, you are doing nothing. So the need not only is in normal level, it actually decreases. So if the need decreases, heart will also accommodate itself. It will, আমার দরকারই নেই, when I have no issues or no need of that much oxygen, why will heart beat more? So the heart rate, also the respiratory rate will coming be a little bit down. Okay, but whenever you are getting up from sleep, you are seeing its things, you are standing up, you are walking, or you are just even sitting up, okay, then again the need comes back to normal. So this is physiological. When you are sleeping, your heart rate, respiratory rate will go down, but whenever you wake up, it will be coming back to normal. So এখানে কি আমার বাইরে থেকে কোনো ওষুধ লাগছে? The stimulant here is sleep. You are feeling sleepy, okay, and ঘুমিয়ে গেলে কমে গেল, whenever you wake up, it will be coming back to normal. So this is physiological bradycardia. In case of athletes, okay, now in case of athletes, there is a compensatory mechanism. Continuously they train for 5 to 6 hours every day. So continuous tachycardia, first and foremost, when he starts training for 1 to 2 years, 1 to 2 months, or 6 to 7 months, in his or her, first and foremost phase of training, slowly his or her body will get accustomed. Now, if someone is having continuously, high cardiac output and continuously high respiratory rate over the time period, in compensatory mechanism, in case of a negative feedback mechanism, those athletes will have naturally low heart rate, right? Because their body is accustomed to pump more blood, their stroke volume is higher, their oxygen intake is higher. So that's why even if they have a little bit of less heart rate, little bit of less respiratory rate, they don't have any problems. Their body is accustomed like that. But it is not like that. যে 5 মাস আমি exercise করলাম, I have been performing or training for being an athlete for only 5 months. My body is accustomed. This is long term. Okay, this is short term. This we see every day. But this will we have only seen professional athletes who have at least trained for 5 to 6 years, 4 to 5 years. And slowly over the time period, their body gets accustomed to that. This is they don't need any kind of, after they retire, slowly but surely over 5 to 10 years, slowly but surely their heart rate and cardiac rate, heart rate and respiratory rate will be slowly going a little bit up, because they are resting, they are not actively doing exercises, right? So this is physiological also. Now pathological bradycardia, pathologically there are also some situations where your heart rate and respiratory heart rate, in case of this we are talking about pulse, so pulse will be down. So what are those diseases? Myxedema, okay, related to thyroid hormone. You will be in detail the pathology behind it or pathophysiology behind it, you will be knowing in endocrine. Next, so arekta reason ache khub easy to understand, that is heart block. If you have heart block, naturally your body will not pump much blood, okay. So first and foremost, your heart rate, your cardiac output will decrease. If your cardiac output decreases, your pulse rate will also decrease, right? So there is lowerment of pulse. Now the thing is, why are we calling it pathological? Because in case of heart block, if we don't remove the block by either surgery or by medicine, it will be getting worse, okay. Over the time period it will be getting worse and the person will ultimately die. If untreated, the person will ultimately die. So we need outside intervention. In this case the intervention is surgery or medicine, whatever, the cardiologist will decide. In this case we need to control the levels of your TSH and also your T3 T4. Myxedema to thyroid is related, right? So in this case also, the pathology behind thyroid, TSH, that's and heart rate, you will be seeing it in endocrine. But for now, understand this. So that's why this is pathological. If we don't control the level of those things, it will get increased and the person will progressively get worse. So that's why it's pathological. Physiological tachycardia, সবাই জানে, exercise. Also emotional excitement, emotional anxiety, when a person is anxious, when a person is emotionally very excited, পরীক্ষায় ভালো নিট পিজিতে চান্স পেয়ে গেছো, আনন্দ হচ্ছে, your heart rate increases, right? Next, females have been understood to have typically more heart rate or more pulse rate than females. So tachycardia is normally more in females than male. Females have actually more heart rate than males. This is sex related. Next is your another thing, newborn and also babies. A newborn not babies, old age, and also fetals. Fetus মানে মায়ের উম্বে যারা থাকে, fetus, okay, a baby which is growing in the mother's womb. So fetus, newborn and old age, in all these cases also the person will have more heart rate. So that is all tachy, but they don't need any medication. A fetal newborn, when this baby grows up, slowly but surely his heart rate and pulse rate will go down, okay. আমরা এক্ষুনি এজ রিলেটেড পরপর in various ages what is the average pulse আমরা এক্ষুনি দেখবো, তখনই বুঝতে পারবে. In old age, the person, because of his old age it's happening, okay, we cannot reverse it, we also don't need any medication, this is normal. So all of these are actually physiological tachycardia, okay. We don't need outside medication. Your excitement drops, this baby grows up, okay, these 6 changes, it all happens, it all changes into normal, it all changes back into normal limits. So within normal limits everything is okay in these cases. So these are all physiological tachycardia. Now pathological tachycardia, remember in case of myxedema there was brady, So whenever the TSH, there will be thyrotoxicosis. Okay, myxedema opposite thyrotoxicosis. Okay, thyrotoxicosis means very much more production of thyroid hormones, which is causing toxicosis. তোমরা এগুলো পড়েছো. So this will be causing tachy. Again, it will be understood in case of fever also. In case of fever, your respiratory rate and your heart rate increases. Okay. In case of atrial flutter and atrial fibrillations, in these cases also you have tachycardia. But all of these are pathological. If you don't treat your fever, if you don't treat your thyrotoxicosis, if you don't treat this flutter and fibrillations, there will be progressively the patient will be getting worse. His pulse rate will never be getting lower without any external interventions. Interventions being treatment of these things or diseases. So that's why they are called physiological, not physiological, pathological tachy. So now, age related, there are various ages in which the person in his various stages of life will have various amount of pulses. যখন fetus এর ক্ষেত্রে, in case of fetus, there is most like 140 to 150 BPM. এটা হচ্ছে fetus. So after that, newborn, in case of newborn, it's 130 to 140. Children up to 12 years of age, less than equal to, children up to 12 years of age. So less than equal to 12 years of age, it's around, it goes up to 100 BPM. Okay. In case of adults, এবার বাচ্চা বড় হয়ে গেছে. In case of adults, it will be, যেটা আমরা নরমাল দেখেছি, 60 to 100 BPM. তাই তো? And in case of old, আবার ওরা বড় হয়ে গেল, old হয়ে গেল. In case of old ages, it can also go up to 100 BPM. All of these are within physiological limits in various age groups. In various age groups, this is normal. When you are seeing a baby, or not a baby, a child of 10 years of age, and you are seeing 100, 102, you won't be needing any kind of external medication, or you don't need to panic, because this is normal level for them. But whenever an adult is having persistently 100, 105, 110, you need to check a little bit. So just like that, this is the normal value of pulse in different ages. So this is your rate. So rate is completed. Okay, this is the most interesting and most asked about questions in this pulse chapter. Now we will be getting into rhythm. Rate amader hoye gelo. Now we will be getting into rhythm. So what is rhythm? Rhythm is actually your regularity of your pulses. Like তোমরা এবার যদি pulse feel করো, এখানে যদি feel করো, you will be seeing the interval between two pulse thrusts actually are equal. Like beep, 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 beep. এরকম করে তো আমরা পাই pulse-টা. Okay. So the time distance between two pulse you are feeling are actually equal. Okay. So in this case, we will say the pulse is regular. Okay. So there is regular pulse and there is also irregular pulse. So irregular, in case of irregular, there are two divisions. One is regularly irregular, another is irregularly irregular. So what is regularly irregular? Okay. So now this timestamp will have its limit, because whenever the person is having maximum, a normal person can have suppose 100 BPM. Now it's happening in 60 minutes only, 60 seconds only. So in this case, the average time period, the T is equal to 10/6. Okay, 10/6 means around like 1.6 or 1.7, 1.69 ऐसा करता होगा, right? So this time is also constant. Maximum the time can be like this, and minimum the time can be 1, because 60 তো আমার normal lowest value ছিল, তাই না? তাই তো? So this time is also between 1 to, মানে এটা আমি হয়তো ভাগটা ভুল করেছি, whatever, you can understand. So the value will be between 60/60, value of T, this time will be between 60/60 to 10/6, right? 10/6 কেন বোঝা গেল? Yeah. So this time period between two pulses will be maximally be 10/6 and minimally be 1 in a normal person. Now suppose one pulse you are getting like this. So now we will be going into irregular pulses. What is regularly irregular, you are getting one pulse is beep, 60 সেকেন্ডে 100, তাহলে 1 সেকেন্ডে ও 1 সেকেন্ডে কটা বিট হবে, the time will be changed, উল্টো হয়ে যাবে। Okay, so whatever, you get the idea. So anyhow 60 second হ্যাঁ, so the time period between two are actually constant. Now you are getting okay, so this is your T1, this is your T1, this is your T1. So in this case if this is your 100 bpm value, okay, in this case since the time period is if this is your 60 bpm value, okay, matlab t equal to 1 second. Now in this case this T1 will be much more higher, আমরা অনেক গ্যাপে শুনতে পাচ্ছি, so definitely this 60 will be very much less, it will not be 60, it will be less than 60, right, because this T is getting higher. Now if the pulse is irregular, no, itself the pulse is, the rhythm is normal, the rhythm is okay, the distance between, the time distance between two height pulses are okay, but actually this rate is not okay, right, so we will be calling it irregular pulses but regular. So that is regularly irregular, because when I calculate the time distance between two pulses, the time is equal, so your pulses don't have any abnormality or irregularity in between the thrust, but overall if you check the pulses then you will get the value is not normal, so that is regularly irregular. And what is irregularly irregular? You are hearing like your pulses like beep 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 beep, so there is no consistency between the time period, like here you are seeing like this, like T1, T2, T3, T4, like every beat is different with each other, so that means not only the pulse the time period are irregular also, but the value will also be irregular. So in this case we can call it irregularly irregular, because not only the pulse rate is abnormal, but also the time distance between each pulse is also irregular, so that is irregularly irregular and that is regularly irregular. Difference বোঝা গেল? In case of rhythm you don't have to understand more than that, pathological causes পরে তোমরা সব পরে বলা হবে। Okay, so this is your irregularity or rhythm of your pulse, right? Next is your force. What is your force? Now whenever you are feeling your pulse, what is it? It is the pressure, it is the pressure you feel over your pulse, okay? So next is amount of pressure. So আমরা কি, now here it comes, how do we assess the pulses? একজন চলে এসো, এই তুমি আসো, দাও ডানা দাও। Okay, first you have to stand or sit on your comfortable pose. If you are left handed you can check like this, if you are right handed you will be checking like this. Now when you have your personal chamber, nobody is coming to see you, তুমি এইভাবে এইভাবে যেভাবে ইচ্ছা দেখতে পারো, but whenever you are in first year and you are performing this thing in case of senior most or normal in your examination, you have to maintain your protocol, okay? So the typical protocol is 3 finger protocol, তিনটে আঙ্গুল দিয়ে করতে হয়। how? Okay, হাত এরকম করো, semi prone, semiflexed. Now what will I do? First I will take my 2 fingers, these 2 fingers, index finger and your ring finger, so এগুলো দিয়ে আমরা এরকম ভাবে artery এরিয়াটাকে above the radial head, over the radial artery, I will be taking these 2 fingers, then we will be dragging them and creating a gap, then we will put the third finger and we will feel the pulses. একদম সুন্দর আমি ফিল করতে পারছি, ওকে, সুন্দর ফিল করতে পারছি। সো দিস ইজ দ্য প্রসেস, সবাই দেখতে পেলে? তো তোমরা এমনি ইন জেনারেল সেকেন্ড ইয়ারে ওঠার পর থেকে তোমরা এভাবে ফিল করো, নো প্রবলেম, বাট ফার্স্ট ইয়ার কাইন্ডলি প্রোভাইড দিস, because otherwise in your exam the examiner will be very angry, okay? Okay, so this is the first thing, the process. And second is what is force? এবার দাও। Now again আমি যদি এরকম করি, so force is, এবার দেখো আমার তো অ্যাকচুয়ালি এইখান থেকে আসছে, the blood flow is from here, so if we try to obliterate this pulse, okay, we will have to, this is proximal finger, proximal মানে closer to the head, distal, so your proximal finger you have to press your proximal finger to obliterate. So the amount of, বসো আবার ডেকে নেব, so the amount of force you need to apply over your proximal finger to completely obliterate the pulse is called your what? Force, right? This is the force. Why? Because that is the actual force you are doing to negate the blood flow, to negate the pressure. So that's your force. Okay. So the amount of pressure your proximal finger needs to obliterate, completely obliterate the feeling of your pulse is called pressure. Okay, or force. Sorry, the pressure is called force. So this is your force. This is approximate measurement of your systolic blood pressure. Okay? Because during your systole, this is the blood flow is happening. So this is your approximate measurement of systolic blood pressure. This force is amount of pressure you need to provide with your proximal finger to obliterate the feeling of pulse, right? So this is your force. This is approximate measurement of systolic blood pressure. এটাই হচ্ছে systolic blood pressure. Next is volume. Okay. So in normal case, তোমরা নিজের হাতে এরকম করো, সবাই করো. Everyone do this. Okay. Everyone do over your hands. So now you can feel a sudden thrust. You can feel a sudden thrust in your pulse. প্রত্যেকে feel করতে পারছো. So that thrust is actually your volume. Okay. Whenever a person is suffering from dehydration, a person is suffering from fluid loss, okay, so the amount of blood flowing through his arteries will be less. Okay, তাই না? Because his cardiac output will also be down, because overall the person is having hypovolemia, right? Less amount of fluid in his blood. So in his veins or arteries, in his body circulating system, less amount of fluid. ঠিক আছে? So now the circulating system has blood as a main fluid. ঠিক? So this is your volume. Everyone can feel this volume. Now if I measure this in a normal person, you can feel a certain volume. But whenever I will feel in a dehydrated person, okay, we would not get the certain amount of thrust. আমরা একটু low পাবো, because the amount of fluid running through this artery are less. So the volume will also be, the amount of thrust will also be less. The force of thrust, okay, will also be less, by which we can assess the volume. So volume is degree of expansion of artery under middle finger. So এই যে আমরা middle finger under আমরা arteryটা আমাদের যে expand হচ্ছে, so this volume we can feel. So the more dehydrated a person be, the more or less volume the person has, this feeling, this pressure of feeling thrust we are feeling on our middle finger will also be decreasing. So that is signifying our volume, and also it signifies the stroke volume. More the stroke volume, the more we will feel this volume force, because the যত volume বেশি হবে তত তো বেশি volume আমার arteries দিয়ে flow করবে না. So this actually signifies your stroke volume. Okay. Next, tension. There was force and there was tension. Now even if your proximal finger, you are flattening your proximal finger, you are trying to obliterate, okay, you will feel a certain, even if it's a very small feeling, but then also you will feel your artery pulsing around. Okay, it is completely obliterated. Even if you are trying to completely obliterate it, after during some time, like first 2 to 3 or 4 5 seconds, okay, you will be feeling very faint amount of thrust over your middle finger. Okay, so now you will be trying your middle finger. You have already tightened up your কি করেছো তুমি proximal finger কে tighten up করে দিয়েছো, then you are trying to obliterate the force, but even after that I am getting my pulse. দেখো এতটা শক্ত করে ধরে রেখেছি, even after that I am getting my pulse. Okay, now I will be trying to flatten the artery. এখানে আমি flatten করব এই পালসটাকে. Now I will be flattening this artery under my middle finger. So this is the tension. Okay, so whenever your proximal artery or with your proximal finger trying to obliterate the systemic blood pressure, okay, use middle finger to flatten your artery. The middle finger artery ke flatten korte gele, the amount of pressure over your pulp is what? Your tension. So difference between force and tension is, force is measured by your proximal finger. Amount of pressure your proximal finger has to put to obliterate the pulse, or to almost obliterate the pulse, is called your force, but the amount of pressure you need to provide with your middle finger when you are trying to control the SBP or obliterate the SBP is called your tension. So tension is measured by or felt by this finger, whereas force is felt by this finger, right? So this will signify, now একটা ব্যাপার ভেবে রাখো, already আমি আমার in biproximal finger already I have controlled my systemic blood pressure, already I have obliterated my systolic blood pressure, which the blood pressure that remains diastolic, right? So this tension is also a signification of your what, diastolic blood pressure, whereas that force was a significance of your systolic blood pressure. এবার বোঝা গেল কেন ওটা systolic কেন ওটা diastolic. After I am obliterating the systolic blood pressure, okay, whatever I am feeling is only our diastolic. So when I am trying to obliterate it by our middle finger, that means we are trying to obliterate the diastolic blood pressure. So whatever pressure we will be need to exert here, that is signifying your diastolic blood pressure. বোঝা গেল একদম. Next, তো আমার ভলিউম হয়ে গেল, টেনশন হয়ে গেল, this is your tension. So this pressure is approximate measurement of diastolic blood pressure. Now the thing is, এবার তোমরা ভাবো, if a person have if your middle finger has to exert very mild pressure to obliterate this diastolic blood pressure, that means your diastolic blood pressure is low. একটুখানি, if you have even provide a little bit of pressure and it's obliterated, then your diastolic blood pressure is low. In case of normal person, it will be getting getting obliterated by mild pressure of your middle finger. Now in case of person who have high blood pressure, high diastolic blood pressure, in those cases you will have to provide more force. So not mild, but you will have to provide high pressure with your middle finger to obliterate the pulse in case of a high blood pressure, the hypertensive patient. So that's why in case of mild or in case of medium pressure, that is in case of normal person, whenever we have to put very light pressure and this is obliterated, you can definitely say the person is suffering from low diastolic blood pressure. Whenever you have to provide very much more pressure with your middle finger, you can definitely say, since I am having to obliterate, I am having to put more pressure or exert more pressure to obliterate the diastolic blood pressure, that means the diastolic blood pressure is very high. That means the person is presumably he is hypertensive. তখন আমরা কি করতে বলবো, অন্যান্য আরো টেস্ট করতে দেবো, ব্লাড প্রেসারের চেক করতে দেবো, বুঝতে পেরেছো? So actually, so the arterial collapse under whatever pressure you put on your middle finger is actually significance of his or her diastolic blood pressure. তো আমার এগুলো হয়ে গেল. Next is our condition of arterial wall. So আমার এত অবধি হয়ে গেছে, সবাই বুঝতে পেরেছো? ফোর্স হচ্ছে প্রক্সিমাল ফিঙ্গার, tension is your middle finger, volume also middle finger, but volume is actually the level of thrust. Level of thrust you are feeling over your pulp of middle finger, distal pulp of the middle finger. So এইগুলো আমার হয়ে গেল. রিদিম আমরা ডিসকাস করছি, রেগুলারলি ইরেগুলার, রেট আমরা এতক্ষণ ধরে ডিটেইলে ডিসকাস করেছি. Now we will be coming into some clinical functionality. Okay, so okay, দাঁড়াও একটা জিনিস আমি নিয়ে আসছি, আচ্ছা ওটা আমি লাস্টে নিয়ে আসছি. First is your radio-radial delay. There are 4 terms. Okay, radio-radial delay, radio-femoral delay, condition of arterial wall, and also your apex pulse deficit. Okay, very easy to understand. Bolo. Very good, very good. This needs to be moving forward. Why? কোন একটা রিজন হবে. Okay, yeah, you are partially correct. আরেকটু elaborate করো. Very good, the sound. Okay, so যখন তোমরা everyone uses headphones nowadays. Okay, not headphones, ওগুলোকে কি বলে, earpods, eardogs. Okay, so you will see আগেকার দিনে in previous days 5 to 6 10 years ago, whenever we are using wired headphones, they didn't have specific shape. All of them were shaped like this. We just put it in our ears like that. So over the years, when their development happened, they shaped those. Even right ear and left ear have different shape and different orientation of the earbuds, right? Why? Because to accommodate greater sound quality. What is the quality? The transmission of sound through our external ear canal. So So since our ear canals are located or directed anteromedially, তাই না, আমাদের ear canal গুলো anteromedially directed, anteromedially তার মানে এরকম. So our ear canals are directed like that. So if I put stethoscope like this or this, okay, we will not be able to hear the sound properly. So for proper hearing, you will be directing this stethoscope or these earpieces according to your ear canal direction. So in our right ear, our ear canal direction is like this. So this will go in our right ear. তাই না, দেখো ডাইরেকশনটা দেখো. Okay, similarly this will go into your left ear. Okay, now if I put this, so my right ear canal, ধরো আমি এইভাবে ঢোকাচ্ছি, so my right ear canal is facing this way, but whenever you are putting it, it's facing posteromedially. So the alignment will not be perfect. You will be able to hear it, obviously you will be able to hear it. This is a very functional thing, but the proper hearing, perfect hearing, if there is very little sound difference, you will be not be able to hear it. Okay, so for minute perspective, so for minute assessment, you have to put it in the perfect way. What is this? So this is the correct way to put a stethoscope. একদম ফার্স্ট ইয়ারে জিজ্ঞেস করবে, এগুলো জিজ্ঞেস করে. ওকে, they will ask. So এইভাবে তুমি ঢুকিয়ে দিলে কানে, আমি এখন শুনতে পাচ্ছি, রাইট? হাত বাড়াও সামনে, আচ্ছা এক সেকেন্ড, বাড়াতে বাড়াও. ওকে, সো নাও আমাকে কি করতে হবে, হার্ট রেট দেখতে হবে আর এখানে পালস দেখতে হবে. ওকে, ঠিক আছে. সো এভাবে আমি দেখব. So whatever I can hear is this heart sound actually is simultaneous with your pulse. Okay? Now একটা জিনিস সব সময় খেয়াল রাখবে, remember this, I have done it only over her left hand, but whenever you are doing pulse check or any kind of check, if there is a bilateral organ like in lungs, in kidney, in whatever, in limbs, okay, upper limbs, lower limbs, in eyes, in ears, in nostrils, whenever there is a bilateral area, okay, always you have to assess both the areas, because it can happen na ki this side doesn't have problem but this side has problem, hote pare there is a blockage on this side. So if you are checking this side and you say okay this is okay, দেখা গেল এইদিকেই প্রবলেমটা ছিল, তারপর পেশেন্ট মারবে, because he or she has the right to be correct. ও ভালো ডক্টরের কাছে যাবে, তোমার কাছে কেন আসবে? You have to assess the patient properly, no? So পেশেন্টের ক্ষতি হয়ে যাবে, you are missing important diagnosis because you are not checking it bilaterally. So আমি যেমন একদিকে করলাম, we have to always do on the other side also. ঠিক আছে, জাস্ট এখানে আমরা দেখাচ্ছি বলে এক সাইডে করছি. এখানে যখনই কম্পিটেন্সি টেস্ট নেওয়া হবে, সবকিছু নেওয়া হবে, অলওয়েজ ডু অন বোথ আইস. এটা অনেকে ভুলে যায়. আই ডক্টর যখন চেক করে, ইভেন ইফ ইউর ওয়ান আই হ্যাজ প্রবলেম, তুমি যদি কমপ্লেন করছো আমি এই চোখে একটু অসুবিধা হচ্ছে, he anyways he does that over check your both eyes, right? Because হতেই পারে এই চোখে কিছু একটা ছিল, you are not feeling symptoms doesn't mean this is perfectly okay. You have to check, ঠিক আছে? ঠিক তেমনি এখানেও আমরা দুদিকে চেক করব. But whatever I was talking about, this is your apex pulse deficit or apex pulse delay. What is apex? In case of cardiological systemic investigation, you will be listening to one term, apex beat. For now এটুকু শুধু জানো, apex beat is your heartbeat. It's located at the apex of your heart. Over there we can hear heartbeats. So the stetho, where I put it actually over this mitral area, okay, over the bicuspid valves, over the mitral area, over there only you will be able to hear your heartbeat most properly, and that's why that area is called apex, and that area is called apex beat. So apex pulse deficit, that means you are feeling it over with your stethoscope, you are feeling the apex beat, you are feeling that beat, your heart rate by your stethoscope, and you are also feeling the pulse by your hand. So in an ideal scenario, in a normal person, this deficit will not happen, because the movement from this area to this area happens in milliseconds, right? So whenever you will be hear your pulse, hear your heartbeat, you can feel your pulse. They are simultaneous, they are not alternate. Okay, so if you can hear your heartbeat and after a little gap you can hear your pulse, that means there is a deficit. Okay, ideally you should be able to hear them in a sync, in a perfect sync. এই যে আমি শুনলাম, I have heard in a sync, I am hearing this first sound and I am feeling this pulse at the same time. That doesn't have any difference. But whenever you see, you will you are hearing and you are feeling na, even if there is a millisecond difference you will understand ki ekটু পরে আমি পেলাম, you will understand, it's very much understandable. So this is your apex pulse deficit, that means there is some blockage over some area, হ্যাঁ যেখানে এখানে আমার ইয়ে হয়ে যাচ্ছে, এখানে আমার হচ্ছে গিয়ে contraction of your left ventricle হয়ে যাচ্ছে, but you are feeling your pulse a little bit later, so there must be some block or there are a lot of pathological reasons, এগুলো আমরা পরে cardiovascular system এর ডিটেইলে পড়বো, but in this case this is happening. So ideally this apex pulse deficit should be 0, but whenever there is a deficit there will be a problem, so you have to check for this if there is any deficit or delay. অনেকে delay টার্মটা ইউজ করে, apex pulse delay, অনেকে deficit টার্ম ইউজ করে। next is condition of arterial wall, ডানা দাও কি করে দেখবো condition of arterial wall, again এরকম করো, নাও আমি হাতটা এরকম করব, এবার দুটো আঙ্গুল দিয়ে আমি আলাদা করলাম, now you try to feel the artery over your fingers. Now ideally our veins are palpable, বাঁহাতটা দেখাও, শক্ত করো, এই যে veins are superficially palpable, arteries are not, okay, arteries are not, so আমি যদি artery কে এখান দিয়ে ফিল করার চেষ্টা করি I will be not be able to feel, right? If I am being able to feel, that means either the arterial wall has gone stenosis or arterial wall has gone any kind of শক্ত হয়ে গেছে কোনো কারণে, okay, so that's why you are able to feel it, or thickened হয়ে গেছে by any kind of. Ideally superficially arteries are not palpable at all. If you are palpating it, if you are able to feel the arterial wall, you can only feel the pulse, but you cannot feel the structure. Over your vein you can feel the structure of the wall, so if you can feel the arterial wall structure, that means there is a problem. So the condition of arterial wall, okay, compress proximal finger and roll artery with middle finger. If you are able to feel any kind of structure there, that means your arterial wall or your artery in general has a problem, either it has thickened, something has happened, okay, but that's not normal thing is you will only be able to feel the thrust, not any structure you can feel, okay, so that is your condition of arterial wall, okay. Next আমাদের আর দুটো পয়েন্ট বাকি আছে, মেইন দুটো পয়েন্ট, that is radio radial delay and radio femoral delay. What is, how will you check radio radial delay? Okay, এইদিক ঘোরো, আমার দিকে ঘোরো, দুটো হাত বাড়াও, okay, so in those cases, okay, ideally তোমাদের এভাবে করা উচিত, আমি এভাবে করছি, so আমি দুটো হাত এভাবে চেক করব, একদম সেম টাইমে দুটো পালস ফিল করছি, সেম টাইমে, that means your cardiac output is reaching both the areas at the same time, that's why আমি একই সময় ফিল করছি। কোনো একদিকে যদি ব্লক থাকে, if there is block on either side, that side will get little bit delayed, right? Not only block, any kind of problem, arterial wall problem, any kind of problem, artery is thickened, any kind of block, any kind of mismatch, anything can happen, you will be feeling the delay. ওর ক্ষেত্রে আমি কি পেলাম, একদম দুটো পারফেক্ট সিঙ্কে আমি ফিল করতে পারছি, that means her cardiac output, her walls, that's absolutely okay. He has, তো আমার ফাইন্ডিং কি হবে, this person has no radial delay or no radial delay noted in this subject, এইভাবে আমরা বলবো, that means it's okay, her condition is okay. So another thing, এইবার আমরা এই বসে পড়ো, আর লাগবে না, next last point is your radiofemoral delay. Now I have already talked about some arteries over which you can feel these pulses. So first একটা carotid বলেছি, next আমরা radial বলেছি, এর নিচে আর কি আছে যেখানে আমরা পাই, ইনফেক্সে কি আছে বলো, femoral artery, okay, there is a canal here, that's called femoral canal, it can includes femoral artery, femoral vein and also nerve, okay, तीनों पास रहता है. Now this femoral vein, femoral artery are very much more or very much thicker, their lumen is bigger and they are also very much longer than this radial or carotid, all of this. Femoral artery is one of the biggest arteries in our body, so the bigger the artery is, the more the blood flow, the more the pulse and more the thrust, okay. So in some dehydrated persons it's very natural, they have very much peripheral blood volume, তাই না, because the person is dehydrated. Those person who regularly stays in coma or in a unconscious or semi-conscious state, especially neurological patients, orthopedic big OT patients, okay, those patients actually they have been feeded by Ryle's tube, not by mouth, by tube they are fed, they are fed by tubes, and also other TPN bahar theke erokom ekta TPN hoy erokom bahar theke vein diye khabar deয়. So all of these things actually the person is not able to take normal food and normal drinks, so somewhat his or her BP and also the volume will be less. So in those type of patients often we cannot feel radial pulse well. Okay, so we have to feel femoral pulse. Since the femoral vein or femoral artery or femoral nerve, all of them are very much bigger, so naturally even if you don't feel or not be able to feel the radial arteries or these other arteries, you will be definitely able to feel femoral arteries or the pulses in femoral artery, right? Carotid is also thicker than this radial, so carotid দেখবে একটু জোরে পাওয়া যায়, নিচে হাত দিয়েই বুঝতে পারবে, এখানে দেখবে অনেক জোরে থ্রাস্ট হচ্ছে rather than there না। সো ফিমোরালে তুমি বাড়ি গিয়ে যখন এখানে ফিমোরালে চেক করবে তোমরা দেখতে পাবে ভেরি হাই, খুব স্পিডে, মানে খুব জোরে তোমরা হাতে ভলিউমটা বুঝতেই পারবে, দা ভলিউম ইজ সো মাচ, একদম ফিল করতে পারবে। ওকে, ওখানে আঙুল চাপতেও লাগে না, রাখলেই দাম দাম করে এসে মারে, অনেক ভলিউম থাকে। ওকে, সো আইডিয়ালি when you will be able to hear the feel the radial pulses, তুমি যদি এখানে একটা হাত দাও এভাবে চেক করো, you will be able to feel both together in a sync, no delay. So whenever there is delay on, now আমি কি এইখানকার সাথে এখানে চেক করব, করতে পারি, বাট আইডিয়ালি আমরা এক সাইডে চেক করি। Now this side I am checking, you will have to check for this side also, since the bilaterally present femoral artery, bilaterally present bilaterally, দুই দিকেই আমরা চেক করব। So no radiofemoral delay, radiofemoral delay is also reasons, मतलब not reason, is a abnormality. Now আমি এত কিছু বললাম, তাহলে কয়েকটা রিজন আমরা জেনে নিই। রেডিয়াল ডিলের কয়েকটা রিজন লিখে নাও, পরে তোমরা কার্ডিওলজিতে ডিটেল পড়বে। রিজন হচ্ছে অ্যাওর্টিক কোয়াকশন বা কোয়াকটেশন অফ আওর্টা, কোয়াকটেশন অফ অ্যাওর্টা। নেক্সট আরেকটা যেটা বললাম সিম্পল, অ্যাওর্টিক ডিসেকশন, aortic dissection. Another one is your subclavian artery stenosis, subclavian। খেয়াল করে দেখো, all of these are actually related to the arch, around arch, তাই না? Because whenever your body or your left ventricle is pushing out the blood, it goes through that area and then comes into this limb and this limb. So most of the problems by which you will feel radial delay will be around that area, বুঝতে পেরেছো? Because there it gets into branches and divides into two areas, so there must be some area deformity in those areas by which you are feeling one side normal and one side a little bit delayed. কি কি reason? Coarctation of aorta, aortic dissection and subclavian artery stenosis, right? So these are a few reasons. আরেকটা খুব বাজে নাম আছে, চাইলে লিখতে পারো, this is an inflammatory disease. Okay, it is called, and another thing you have to know these things, gradually you will know, but just know this, itis means infection, itis, dermatitis, keratitis. Okay, arthritis means inflammation, not infection, inflammation of bones, so that's your arthritis. Okay, so in case your artery, so inflammation of artery is called arteritis. Okay, so এই জন্যই বললাম এটাকে বলে তাকাই আসু। Definitely this person told about these things first. So তাকাই আসু arteritis, that means inflammation of artery. Okay, this is an inflammatory condition, তাকাই আসু arteritis. আইটিসটা এই জন্যই বললাম, এরকম তোমরা সব জায়গায় আইটিস পাবে, কোথায় পাবে না? ইউভিআইটিস, ওকে, ডার্মাটাইটিস, কেরাটাইটিস, সব জায়গাতেই পাবে। আইটিস ইজ ইনফ্লামেশন, নট ইনফেকশন। ওকে, সো দিস আর দ্য 1 of 4 রিজনস। আরো অনেক রিজন আছে, এইগুলো আপাতত লিখে রাখো, জিজ্ঞেস করলে বলবে। এন্ড দ্য রেডিয়াল ডিলে রিজন হতে পারে, রেডিওফিমোরাল ডিলেরও 3-4টে রিজন হতে পারে, সেট করে লিখে নাও। সেম কোয়াকটেশন অফ অ্যাওর্টা একটা হবে। First, second is your aortic obstruction. Aortic obstruction. Okay. Next is your Turner syndrome. and final is bicuspid aortic valve. Normally aortic valve কি হয়? Aortic valve, which shape of aortic valve? Semilunar. Semilunar হয় না? এ কি ভুলে গেল? এই কোন শেপে হয় aortic valve? aortaর সামনে যে ভালভগুলো থাকে কি শেপের হয়? Semilunar হয়. Okay. But whenever these semilunar valves are replaced by bicuspid valves, so the term is called bicuspid aortic valve. Normally bicuspid আমরা কোথায় পাই? বাম দিকে bicuspid. So over the left side, in between your left artery and left ventricle. Okay. Oh. So there are semilunar valves over both aortic valve, pulmonary valve. Okay, all of them are semilunar. But whenever this is bicuspid, you can see this radiofemoral delay. So bicuspid aortic valve, coarctation of aorta, aortic obstruction, Turner syndrome are one of the few reasons of this radiofemoral delay. বুঝতে পারলে? আর ভালো কথা আরেকটা যেটা আমরা যে পালস মাপবো আমি যে ওকে দাঁড়িয়ে মাপলাম, okay, I have measured it while she was standing. Ideally it's not okay. Okay, ideally since वो 5 मिनट से ज़्यादा 1 घंटा आधा घंटा बैठी हुई है, she is already properly rested, that's why আমি সেট করে দাঁড়িয়ে দেখে নিলাম, ঠিক আছে? বাট আইডিয়ালি তোমরা কি করবে, এখানে 5 মিনিট পেশেন্ট রেস্টে থাকবে, বসে এরকম ভাবে হাত দিয়ে বসিয়ে দেখবে, ওকে? You will be standing but the patient will be in a sitting position, okay, not lying down, not standing up, because when the person will be lying down the heart rate will go, pulse will be down, person will stand up, it will be little bit up. This is postural difference, এটা সবারই হয়।